today. I'm with the CDC Travelers Health Branch, and to give you a brief outline of why we exist, our mission is to safeguard the health of US travelers who are traveling internationally or living internationally. So we have over 60 million Americans spending at least one night out of the country each year. And of that, in 2013, 6.5 million traveled to the Caribbean region. About 3/4 of those traveled for leisure, vacation, and so forth, and about 14% of US travelers came to visit friends and relatives in the Caribbean region. So there are three things I want to talk to you about today, very briefly. Firstly, a little bit about our pesky travel notices. Secondly, about some background information about an investigation we did with US travelers to the Dominican Republic. And lastly, some surveillance data about travelers returning to the US with chip. So firstly, our travel notice. I think you're probably all aware of the CDC webpage. One of the biggest components of the CDC webpage is the travel health webpage. If you haven't used it before, I'd ask you to take a look at it. It's a really large webpage. We get something like 35 million page views a year, and we have a lot of destination, disease information, and so forth there. But one of the things we do post on the site is our travel notices. And the reason we create travel notices is to provide risk information to travelers, anything that might impact their risk while they're traveling abroad. So we're definitely thinking about travelers as we post these notices, but we also are aware that there are clinicians preparing these travelers for their trips, and this is also a way of communicating to other public health professionals around the globe. We only use reliable, confirmed sources for these travel notices. We don't use media reports, for example. If I could refer, Dr. Hines referred to the one report of the Caribbean, Chikungunya in the Caribbean. We were referred to a PAHO report for that travel notice. But sometimes these things can get a little confusing, and we correct them as quickly as possible. Usually our notices are country-specific, but what we've done with chikungunya, especially in the Caribbean, we create regional notices. And to give you some perspective, we currently have 30 notices for various diseases on our website, and 8 of those refer to chikungunya. So we have 3 levels of notices. The first is a level 1 watch, which really just advises people to take usual precautions. So you will note that our chikungunya notices are level 1 watches, and we're really advising people to prevent mosquito bites. A level 2 notice would be for something where we are advising special or enhanced precautions, and that's usually for a situation where a vaccine might be needed or medication might be needed, or where there is a special at-risk population that might be advised to travel to that area. And then something we use very seldom are level 3 warnings, which advises against non-essential travel to that region. We have 3 warnings up at the moment, and those are all for Ebola in West Africa. So this is the level 1 watch we have up at the moment for chikungunya in the Caribbean. We also wanted to communicate to US travelers as they left the US and came back to the US. And so these are 2 electronic messages that we had up in some of our major airports, particularly airports where travelers travel through to get to the Caribbean or the Americas. This was the incoming message, and this was our outgoing message. I think one of the previous presenters showed this. I saw something similar when I arrived in Trinidad had yesterday at your airport. So moving on to the second topic that I wanted to mention, we recently did a investigation on a group of returning students to the Dominican Republic. We've been working with a service organization that's based in Texas that annually sends a few thousand high school students to South America and the Caribbean for 4 to 8 weeks over the summer break. And they typically send about 150 to 200 students to the Dominican Republic. And some of their advanced staff in June of last year had symptoms that were suspicious of chikungunya, and they were scared, concerned about the students that had either arrived or were due to arrive. And so with collaboration between this organization and the state of Texas, we launched what we call an EpiAid, which is a response mechanism. And we were interested in determining the incidence of chikungunya in this population of travelers, consider how effective mosquito bite avoidance measures were, and look at recommendations for this group and other groups traveling. So we had a very limited time frame. Many of the students were already in the Dominican Republic. We realized we couldn't travel to the DR to do a study, but we noted that all of them were returning to the US through Miami International Airport, and we have a quarantine station there. And so what we organized was to corral these students as they came back on various flights. I think they came back on 4 different flights, and conduct a survey where we looked at their exposures, we looked at their knowledge of chikungunya and dengue, and whether they reported symptoms during their travel. And we also took a blood draw. And we had to do this very quickly because most of them just had a short layover before onward flights. So it was a collaborative investigation with authorities at the airport and other groups, including contracted phlebotomists. And we had special areas in the airport set aside where we had set up phlebotomy stations. So the results were pretty interesting. They're still pending. We have an abstract into the International Society of Travel Medicine, which is meeting in May in Quebec. And we have a manuscript in preparation. So officially I'm not supposed to say anything, but just between you and me, there were about 140 students down in the DR. Of those, we had a full survey and blood draw from just over 100. I think it was 103. And of those, 48% seroconverted to chikungunya. So that's a pretty high number. And of those who seroconverted, 80% had indicated symptoms that suggested chikungunya. 80%. So the last thing to talk about, and I think I've got a few more minutes, is surveillance data on US travelers returning from the Caribbean, or returning with chikungunya, I should say. So we have a national arboviral disease surveillance system called Brunette, and since 2006, states have been able to report chikungunya into Brunette, but it was not a notifiable disease. But as of this year, Chik is nationally notifiable. I've got 5 more minutes. So firstly, this period of 14 years, from 1995 to 2009, this map indicates where chikungunya cases were imported into the US. The diagonal lines just indicate where there is a viable vector, but the colored-in states indicate where chikungunya cases were identified. And in those 14 years, we had 109 chikungunya cases in the US. Of those, about 57% came from India, a another 8% from other Asian countries, and 28% were unknown. And then for the next period, which is just 4 years, again, you can see the colored-in states indicate states that received a imported case of chikungunya. And in those 4 years, we had 115 cases in the US, and 32% of them were from India. Then in 2014, things changed. You can see just about every state had an imported case of chikungunya. Florida had 11 locally transmitted cases, but the US saw 2,021 chick cases. And as I mentioned, 11 were locally transmitted, and all of those in Florida. We also saw just under 4,000 cases in Puerto Rico and the US Virgin Islands. And if you look at the percentage, 98% of those 2,000 cases seen in the US were imported from the Americas, that's Caribbean and South America. 2015, we've already seen, up until February 10th, we've already seen 25 cases. All of them were travelers, none locally transmitted. And again, this is the distribution of Aedes aegypti and albopicus in the US. So we have viable vectors throughout the south and southeast of the country. Last thing to mention is our group has a global surveillance system called GeoSentinel, which is a provider-based global surveillance system. We have 54 clinics around the world that look at international travelers. And so far, this is by December 31st, these 54 clinics had reported 207 chick cases in travelers returning from the Caribbean. Thank you very much.